Hello, everyone, and welcome once again to the Talk to Defeat ALS podcast. I'm your host, Tony Heil, with the ALS Association Greater Philadelphia chapter. If you listened to our podcast before, which you can find on iTunes or on our website or at alsphiladelphia.podbean.com, you will know that we've talked with many different people about a vast array of experiences and perspectives when it comes to ALS. We've spoken with people who are living with the disease, people who are caregivers, people who are staff, board members, walk teams for the Walk to Defeat ALS, and of course our terrific care services staff who are at the front lines of patient care every day. Today I'm recording this during Nurses Week 2019, and our chapter is proud and really privileged to have some amazing nurses who are providing quality care to people with ALS throughout our territory. You can learn all about our care services staff at www.alsphiladelphia.org, or if you're listening from outside our chapter area, find a chapter near you at www.alsa.org. And today I'm talking with a nurse who has never spoken on the podcast before, but who has spoken with many different people with ALS to offer them kindness and support through their ordeal, and that is my friend Erica Smith. So Erica, thank you for joining the podcast today.
Thank you for having me, Tony.
I start off, and like I said on the intro there, I'm very excited to have these amazing nurses be on the staff and be there for our families. And you are here to be a nurse for a specific group of people with ALS, correct?
Correct.
So tell us a little bit about what you do. Where are you, and what does being a nurse mean to you for the ALS Association?
So I live in Drums, Pennsylvania, which is near the Pocono area, and I cover the north central region of the state of Pennsylvania for the ALS Greater Philadelphia chapter. So Mary Beth Tomzak and I, who was recently on the podcast, she's a social worker and I'm the nurse, and we cover a total of 19 counties. So we're basically up to New York, into New Jersey, at the line, as far west as State College, and down to the Allentown area. So we cover a huge area. We have about 120 patients presently, give or take, that are active with our chapter right now. I became a nurse, it's 14 years ago, actually, in May. And I've been with the chapter for 3 years in September. So it's been a great 3 years. It's definitely been the best couple years of a career that I've chosen. This is like the best job I've had ever since entering nursing. I absolutely love it.
So I'm really glad to hear that. I'm sure that our families are glad to hear that the nurses care about and love what they do. What made you decide to be a nurse in the first place? Just obviously it wasn't just something to do, right?
Right. Well, actually, my first degree was in psychology, and I graduated, and I ended up going to grad school at the University of Pittsburgh for a little bit, and I was going for child psychology to focus on just like school psychology and education and stuff like that. And then my mom had actually gotten sick, and I had to pretty much just put everything on hold to come back home and help with her. And she basically was in the hospital in and out, and I had seen the nurses and just watching what they were doing. And I thought, this is a career that really gives back to people, and you really feel appreciated, because I was kind of like in that space where I was unsure of what I was doing was really the career path that I wanted, and you're only like 22 years old and you don't know what you want to do. So at that point I thought, you know what, I really want to do something that matters and something that has a lot of stability for the future, and I knew there was a high demand at the time. So I looked into going back to nursing, and I went back at the school I had gotten my first undergrad degree, and the rest is history.
Well, it's great, and you went originally for doing things for kids, right?
Right.
So ALS is a very different population than what you first started out wanting to do, I assume.
Yeah, I tried a lot of different hands with nursing. So I've done basic med-surg stuff where you cover all medical diagnoses, and I did psych nursing, which was super exciting, and I do love that as well. But I kind of landed into the ALS Association by pure luck. It was just at the time I was doing home health and I was just not super happy with what I was doing, and I just wanted to do something new and challenging, and I had found this job posting for the ALS Association, and I thought, hey, I'll apply, and I ended up interviewing with Sue Walsh, and right from the get-go, I just loved the whole mission of what we do, and it was just a perfect fit for me.
Well, I think so far our families up in Northeast PA hopefully are feeling it's a perfect fit working with you.
Yes, we have some great relationships with our patients, and I mean, we try and stay in touch as much as possible. We're here for them for any question, and any challenge is no challenge is too big for anything we have up here. But we have great relationships with our patients, and we really enjoy what we do.
So for people who don't know, who are listening, or people who do, when our people with ALS come to our clinics, our treatment centers, or if they come to the chapter in general, they may talk to many different kinds of care professionals. There's social workers, nurses, obviously neurologists. There's assistive technology with Elisa Brownlee. There is also help from speech pathologists and people who are helping with physical therapy and occupational therapy, nutritionists. What does being a nurse mean in the fight against ALS for all the families you support?
Well, basically, I think being a nurse, you play a lot of different roles. So you're there for not only guidance as far as medical issues, but you're also just a resource for them as far as what kind of options are available to them. And so you kind of play a lot of different roles. It's not only just medical, it's just overall well-being and just mental health and the whole 9 yards.
And when you first started here, was that something you were prepared for? Is it something that you have to really evolve to be able to take on all of these challenges and to tackle ALS from so many different angles?
It was definitely a learning experience till I felt comfortable doing what I'm doing and being able to give people trustworthy advice and making sure I'm giving the right information. So it took a little bit to just get used to the whole issue of ALS and just what it actually pertains to. I mean, back in school, you don't learn very much about education related to ALS, and you kind of have an idea of what it is, but the biggest challenge is awareness with ALS and just making sure that people know what it is and know how to help and just, be there to help support these patients that are affected and their families.
Now, I am recording this podcast in Montgomery County, right outside of Philadelphia. So I'm in a more urban/suburban area. It's a very populated area around here, well-educated. And not that your area is not well-educated. Not want to say anything bad, but
no, I understand.
Your area, Northeast PA, is like many other parts of the country, too, where it's not connected to major cities, maybe. People live an hour or so away from a hub, like a Scranton even. So most of the people you see might not be in the city. Is there a lot of education that needs to happen? Are people not aware of ALS in the same way that they might in other areas? Does that pose a challenge for someone like you in your area, as opposed to someone who is a nurse in Philadelphia or even at Hershey, where it's a big hub?
I do. I think that being in a bigger city, you are definitely more aware, I think, of more things, because I think you see a bigger vast of diseases and diagnoses. But up in this area, I just think that it is so small and it's more tight-knit, so it's like everybody kind of knows everybody, and there's a lot of connections that way. And education, no matter, I think, where you are, is always, people always need to learn more. And so we do run into people up here that don't know much about ALS, but I feel like that's kind of a common thing everywhere. No matter what, there's always something more you can learn.
And on the flip side, I often hear that can be a challenge in the urban areas where some people know too much. So they hear that there's an ALS diagnosis and suddenly, they've read up on the internet on everything. They have They have all these questions, and they already have a viewpoint, so they don't come in as a blank slate like they might for someone else, and that may be hard to change. Does that make sense?
Yeah, definitely.
So what does it mean to you personally to be a nurse? Is it something that you're excited about and happy? Is it's rewarding then?
Oh, it's definitely rewarding. It's definitely the best thing I've ever done, and I'm so glad that I made this choice.
What are the biggest challenges for being a nurse and for being a nurse for the ALS population?
The biggest challenges, again, goes back to probably just education and awareness, and just making sure that there's as much help out there as possible, and just making sure that everyone knows, what they can do to help and make a difference in this area of nursing and healthcare overall.
And I spoke with Mary Beth Tomzik, like you said, you guys work as a team, I assume, right, in that area?
We do. We try to, we're both actively involved in every patient that we cover, but we kind of throw different ideas off of each other, which is great because for being a social worker, we throw the social aspects that way. And if there's any medical questions, then of course she throws that my way. But we're a great team, and we work great together.
That's good. I imagine it's very hard to be a nurse in general with a lot of challenges. It will be very hard to be a nurse without any help.
Exactly, yes. You definitely need help. That's the best thing about nursing. I think I've always just felt like, it's everything's a teamwork approach. And once you do it that way, it definitely makes everything fall into place.
Now, if I was someone who was facing a new diagnosis of ALS, whether for myself or for a loved one, and I came to see you in one of our settings, you were the nurse speaking at the clinic that day, what kinds of things would I go to you for as opposed to going to someone else? Or would I go to you with everything? Or are there things that I would be able to say, I'm so glad that Erica Smith, this great nurse, is on board to help me with X, Y, or Z?
Well, I think each clinic setting is different. And so we're at Geisinger, Wilkes-Barre, and Geisinger, Bloomsburg. And even though they're both Geisinger clinics, they both do have a different sense of things pertaining to each clinic. So in the Geisinger, Bloomsburg clinic, I do more of like a nursing assessment. And I basically work with the doctor and the nurse practitioner, and I basically assess what's going on and kind of just give them the heads up as to what current issues are going on. And then Mary Beth comes in separately, and then she actually does the social assessment as far as if they need any help in the home, or if they have some issues with accessibility programs and stuff like that they need to talk about stair lifts, and they want to work toward the waiver process. I actually manage the loaner program for the whole North Central region also. So that's a program where we have equipment or any type of durable medical equipment that can help the patient manage in the home. So that's a huge challenge that I cover too. So that takes a lot of effort, and sometimes it can be difficult just to get things for patients in a timely manner. So based on the way the mileage is up here, like I could have a patient that needs something, but I cover this county that's up near the New York line. So sometimes it's just a little challenging getting things to patients that are super far away versus like if I was in the city, it makes it so much easier because everything is in a 30-mile radius. So that's a huge challenge up here.
It's a huge challenge, but kind of shows how necessary it is to have someone like you in that area, because without you and Mary Beth, where would they get the support they need?
Exactly, and we do run into that a lot where we have patients that never were even referred to the ALS Association, and they don't have any idea that there's loaner equipment out there, that there's in-home programs, that there's accessibility programs to help with stair glides and ramping and all that stuff. So it's crazy to think that people wouldn't want to pass along that information. And sometimes we meet with patients and they were diagnosed, a year or two ago, and they're like, we never even knew that all these resources were available. So in that instance, it makes you feel good that you're truly helping these people.
Yeah, it's really exciting to me as someone who works on the other end here, seeing that people are getting the help that they need that they would not get anywhere else. But you're right, the education is often a challenge because no one thinks about ALS till they have it, I assume.
Exactly. It's the same thing. Like I always say, I don't know what I would do if I had to make these choices that the patients do. And you really don't know until you do experience it and you're in that situation.
So these are a lot of things you have to do, and you also have 14 counties, like you said. Some of them have 20 people with ALS, maybe. Some of them have 2,
Right.
spread out. And dealing with different counties is a big challenge too, right? Because they have different rules or different people to talk to for
Exactly.
programs.
Yeah. Mary Beth runs into that a lot with the social services aspect because a lot of the programs for waiver and just any kind of in-home care, anything like that with medical assistance and all that, it is, the rules just vary from county to county, so it does make things tricky.
And I assume even as a nurse, you have to, be up to date all the time on the rules changes, the insurance changes. You have a lot that you just need to study and, be clear on because the healthcare system is constantly changing.
Exactly. I mean, it could be difficult even sometimes if I have a patient that lives in one county and they need home health, and you can't even find, sometimes that's challenging just to find a home health that'll go out to certain counties, and so it's always, every day is a new challenge.
Well, I'm glad you're doing those challenges, and you say that it's rewarding. So why would you want more people to go into nursing in general? Do we need more nurses?
We definitely need more nurses. They say that the demands are just getting higher and higher, and a lot of people don't want to work in direct healthcare in nursing, and some people think that that's all there is, that if you become a nurse you have to work in a hospital, and that's not necessarily true. So it's a great awareness that for people to know that there are so many different hats you can wear as a nurse.
I don't think I've ever seen you wear a hat.
What's that?
I don't know if I've ever seen you wear a hat.
Oh, I love to wear hats, especially on bad hair days.
I didn't know you had bad hair days. I'll have to wait. I'll have to look for this. I'll put up a picture of you with a hat.
Okay, I have one.
I'm sure you have plenty, like you said. There's a lot of hats to wear. So, you want more people to become nurses. We need nurses because it's a very diverse career, like you said. You can do home health, you can do it in a hospital, you can do for something like this. But you don't just do care. You also participate in a lot of events. So, can you tell us a little bit about the non-care things you do that can be rewarding, like the Walk to Defeat ALS?
Right, we just had our Walk to Defeat ALS in Berwick, which is a town that's about 45 minutes away from the Wilkes-Barre-Scranton area. It's a small rural community, but we just had our walk there last Saturday, so that was the 27th of April. We had not the greatest weather, but we had a great turnout, which was exciting. And, we're still accepting donations up until the end of the year for our walk, and we had a lot of support throughout the local community. And people came from, an hour or two away, and there's just a lot of support in that community. So it was a great event.
And can you give our listeners, because you might be surprised by this, but most people who are listening probably have never been to Berwick.
Correct. I'm sure they have not.
So, for people who are listening, what makes the Berwick Walk special? I know what makes it special, but let people know what makes Berwick such a special area for ALS.
Well, I think it's a huge community that is just super tight knit, and we work with George Curry's son, which is Cause Curry, and he's a great resource, and he knows everyone, and he's able to just bring people together. And I mean, it's not even just for Curry, but it does bring a huge community and following for Berwick.
And George Curry was one of the most winningest football coaches, high school football coaches ever, right?
Correct.
And he passed away from ALS like 3 or 4 years ago at this point.
Yes, I believe so. I believe it was 4. I think it was 4.
Yeah, it really doesn't feel like that long ago, and I'm sure for them it's left a big hole in that community, and hopefully you as a nurse and Mary Beth as a social worker can help to make that hole a little, fill it up a little bit more with care.
Definitely. That's what we aim to do.
All right, so you aim to bring care. Let's just finish this discussion with another thing that you can do. If people need help and they live in your area or anywhere else, what should they do?
So they can always just log on to our website at www.alsphiladelphia.org, and under the Care Services tab, you can locate basically by the region which you live in. You can find support staff, and I'm listed on there, and Mary Beth as well, and we have our contact numbers and our emails. Anyone can call us at any time, leave a message if we don't answer, or email us. We love email, and we'll get back to you as soon as possible. If that doesn't, if they wanted to just call the general number for the ALS chapter office, then they will still definitely get led our way, and we will get them set up and registered with us and begin as much services as we can offer them.
Well, wonderful. I know that every one of our care services staff, whether they're a nurse like you, or if they are a social worker like Mary Beth, or they have another role with us, it's not a competition. So if someone emails and they email you and they say, oh, I live in Chester County and I need help, I heard you on this podcast, you obviously will say, well, great, here's who you can talk to, and you'll make sure that happens.
Exactly, yeah. We all work together as a team, and we all just try to help each other as much as possible and make every day great.
Well, thanks for making so many of our families' days a little bit greater. I know ALS is a challenge, but I appreciate what you and all of our nurses do to support all families with ALS, Erica.
Thank you so much for having me, and it was great talking with you.
Great, and if you're listening to the podcast, again, subscribe on iTunes or on Podbean. Visit our website, www.alsphiladelphia.org, and follow us on all social media channels, Facebook, YouTube, Twitter, Instagram, Pinterest, and LinkedIn, all at ALS Philadelphia. Every bit of awareness helps. Thank you so much, Erica.
Thanks, Tony. Have a great day.